Hello, everyone. It is 9 a.m. and we have a really packed agenda. So I'm going to go ahead and call the Community Homeless Advisory Board meeting to order. And Madam Clerk, well, actually, we'll start with a salute to the flag. Councilmember, let's see, Reese, will you please salute the flag? To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, Madam Clerk, please.
Certainly. Chair Alexis Hill.
Here.
Vice Chair Mayor Lawson.
Here.
Commissioner Lucy is absent. Councilmember Naomi Jordan.
Here.
Councilmember Devin Reese.
Here.
Councilmember Christopher Dare.
Here.
And from the DA's office, Herb Kaplan. Madam, you have a quorum.
Thank you. We will then go to public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the board agenda. The board will also hear public comment during individual action items with comment limited to 3 minutes per person. Comments are to be made to the board as a whole. Do we have any public comment?
We do. We have Eileen Bidwell up first.
Great. Hey, good morning.
Madam Chair, for the record, we do have Commissioner Lucy present.
Thank you. Good morning.
Can I start now?
Yes, ma'am.
Good morning. Eileen Bidwell, for the record, Ward 1 resident. Hope everybody's doing well this morning. I'm here today to talk about two things. First, I want to advocate for Washoe County to join the House America campaign, a federal initiative created by HUD and the U.S. Interagency Council on Homelessness to invite local and regional leaders to join a national partnership to reduce homelessness in their communities. House America is funded through the American Rescue Plan. The goal is to rehouse at least 100,000 households experiencing homelessness by the end of 2022. There is no cost to join this partnership, and there are no additional reporting requirements. Yay, that's good. Membership benefits include access to free technical assistance from experts at HUD and USICH, and the opportunity to learn from the progress and successes in other cities across the U.S., as well as the things that have been tried but haven't worked. President Biden has called House America an all-hands-on-deck effort to address the nation's homelessness crisis. Here in Washoe County, we need to try everything we can to find solutions. You can find more information on the HUD and USICH websites. Next, I'd like to express my deep concerns about Phase 3 of the CARES Campus Plan, which includes building transitional housing. All the current research is showing us that permanent supportive housing is far more successful in helping vulnerable people achieve stability in their lives, including people experiencing chronic unsheltered homelessness. John DeCarmine also recommended this approach. Having a safe, healthy, stable, and accessible home is the foundation upon which everything else is built. Transitional programs do not succeed because when time is up, there is too often nowhere to go. Transitional situations are also stressful for service providers who have to move participants several times. The cost is roughly the same no matter what type of housing is built, so now is the time to concentrate on permanent solutions. Lastly, I want to say thank you to all frontline service providers. I know from experience your jobs aren't easy, and all of you do the best you can to make our community a better place. As always, thank you for listening.
Thank you, Ms. Bidwell. Madam Clerk, anyone else?
Yes, next up we have Brooklyn Leno.
Hi there. I just wanted to come up here on behalf of the Eddy House and give a public comment about what they mean to me and what they mean to so many others in the community of Eddy House. When I came here about 6 months ago, I had nowhere to go. I had no one to rely on and had no idea what I was going to do. They opened their doors to me and they really showed me how to be a functioning adult. I did not know that before. I did not have the tools or the guidance that I needed before then, and I'm truly grateful for all their love and support. They treated me like a family, and so many others like family as well. Having the Eddie House there for me in my life has changed so tremendously. I live in transitional housing, and that's a wonderful little community they have there. There's less rules than the actual Eddie House, which gives you freedom to be an adult and make your own decisions and choices, with also having guidance from them to make the right decisions. I don't know where I would be without them. I truly think that my life is better off because I had met them and because they've helped me out so greatly. They've also helped me fund school. I go to Unitech College. I'm planning on being a nurse, and they have helped me so graciously with their scholarship program. And I just wanted to come up here and let you all know that they are a wonderful, wonderful little community, and I hope you support them. Thank you for your time.
Thank you.
I have nobody else signed in.
Thank you. Okay. Next up, we have minutes to approve from February 7th and March 7th. Is there any changes that the board has to these minutes? Seeing none, may I have a motion to approve both minutes?
So moved.
Second. Thank you. All those in favor?
Aye.
Aye. Thank you. Okay, next up, we have the Eddie House Homeless Youth Facility and Program Updates and Presentation by Trevor Macaluso, Chief Executive Officer of the Eddie House. This is a non-action item. And Trevor, staff gave you 10 minutes for the presentation, correct?
That's right. So hopefully I'll go pretty fast.
Okay, thank you.
Good morning, everyone. I'm here to share with you a little bit about Eddie House. Oh, if the clicker will work. There we go. Our mission is to work with homeless and at-risk youth in our community, develop and life and job skills necessary for sustainable independence. We have a vision to end youth homelessness in Northern Nevada. Our target population is 18 to 24, which is the definition of transitional age youth, inclusive of what HUD considers transitional age youth, which goes slightly below that. HUD says that if a youth or an individual has permanent housing before the age of 25, the risk of them becoming chronically homeless is significantly reduced, which is why Eddie House focuses on this population specifically. A little bit about our values as an organization. We have 5 values, which are commitment both to our clients and to the community at large. And those are that we will treat everybody with collaboration, dignity, we have grit, hope, and kindness. We were founded back in 2011 by Lynette Eddy. She was a Master of Social Work student at the university who was working as an intern at the old Record Street shelter and realized that transitional age youth was the fastest growing subpopulation of homeless within our community. And so upon graduation, pulled together some social work friends of hers and founded Eddie House. In 2015, we moved into a drop-in center, which was operated on 6th Street. That was a day service center, Monday through Friday, 9 to 5. And in January 2020, we expanded our operation to our current facility on Willow Street, which includes now an emergency shelter, our community living program, a transitional housing program. In 2020, we added on our street outreach program. And this year, we've converted our programming in our community living program to be research-based, thanks to studies done by the counseling department at the University of Nevada. And we have launched a diversion program, and we're hoping to launch a pilot independent living home with the county human service agency later this year. This is a layout of our programs and the continuum of what we hope to offer. Our clients are able to jump in at any point. And move forward faster. We really individualize each client to what their basic needs are. But the idea is that anybody we meet on outreach might follow a ladder step that goes from there to the drop-in shelter, to the emergency shelter, our community living program, our transitional living program, or independence. Our diversion program seeks to do early intervention for our earlier entry points. And then if we are able to launch our independent living program later this year, those clients would eventually go right into our transitional program or straight to independence. And I'll talk a little bit about that here in a minute. Our outreach program is a street outreach program where we reach out to motels, youth on the street, local encampments. Sorry, the clicker is not working again. There we go. Apartments. We provide basic essentials, fruit, snacks, warm clothing, hand warmers, etc., along with contact cards and information about Eddy House in order to attract and identify homeless youth that might need our services. We do partner outreach, such as to locations like the CARES campus, local jails, the justice system, Jan Evans, and hoping to expand that to other local shelters that want to partner with us. A lot of our outreach is also based on community awareness, letting other members of the community know about our services and how we help transitional age youth, and is an entry point for us to begin diversion services for youth experiencing homelessness or about to experience homelessness. Our drop-in center is our day services that we offer on Willow Street. Those would be, again, your clickers, showers, pantry bags, mail service, case management, meals, clothing closet therapy, access to all of our programs that we offer for our clients who are in the community program. Our drop-in clients are able to access that as well. We've got laundry vouchers, a medical room, a computer lab, and we hand out other essential supplies such as sunscreen, first aid kits, Narcan as necessary. We have a dental hygienist that comes and checks teeth once a month. We have a gal who comes and cuts hair for our clients once a month. We really try to be able to offer any services that we can to any homeless or at-risk youth who are accessing our drop-in center. Our emergency shelter is located at the same building on Willow Street. Our emergency shelter has a capacity of 27 men is what we're set up for. Again, the clicker's still not working here. And 4 women. And we have additional cots available as our capacity. We're able to always have more than what our capacity is because our building, as many of you have seen, is very dynamic. And we're able to turn a lot of our spaces upstairs into additional cot space. Our shelter beds are reserved daily. We're pretty low barrier. There are no sobriety requirements when it comes to our clients who are accessing our shelter. And our shelter also has 24/7 on-call support by our case management and other management team to help support our youth advocates that are assisting our clients each and every day. Our community living program offers a capacity of 23 men and 6 women. Traditionally, Eddy House has tended to serve a growing number of men over women. That's just been our historical nature, not by any design, just been with the clients who've shown up. However, our female numbers have continued to grow over the last 8-9 months. Our community living program is a 6-month program. It has a higher level of expectations and level of commitment of the client for the client. It is a sober living environment. There is more intensive case management and client success plans that our clients work through. This is what I said is based on research, which is our next slide. We have 5 areas of focus, thanks to the research that the university has done with us, where we want to help our clients become fully aware of their skills and abilities in each of these areas, not only independently, but being aware of what the resources are in the community, so that one day when they're no longer a client of Eddy House, they know how to access these services in the community. Those areas are career finance, housing, transportation, essential documents, community, and self-care. We teach all these subjects through groups. We do about 15 to 20 groups per week. About 80% of our groups are hosted by the community, other nonprofits, other agencies, volunteers, corporations, and the remainder being in-house subjects that we help our clients learn from. Our transitional living program is an up to 2-year program. It has a capacity of 10. It's currently full. And the clients pay a very nominal program service fee and are able to have a case management check-in once a week with in-person once a month to help clients, like you heard during public comment, maintain their path to success and moving towards independent living. We have aftercare that follows up folks who move out of our transitional home. or into any of our programs when they're no longer being supported by a current Eddie House program that follows up within 30, 60, 90 days, 6 months, and 1 year following their exit so that we're able to measure the efficiency of those programs. That's something that we've just launched this year. If we're able to get this approved with Human Services Agency, we'll be launching an independent living home pilot this year, which would act as homelessness prevention for aging out foster youth. They would still be supported by the independent living program under the county, but they would have a house to live in for under 12 months and receive programming that Eddie House would provide with some specific and additional case management to supplement what they're already receiving from the county. Again, if the home like this doesn't exist, what happens is aged out foster youth with nowhere to go end up in our shelter. And so we're trying to create a program to capture those individuals and see how that works this year. A little bit of our data. We had 374 unique clients last year, and 216 of them accessed our services for the very first time last year. 48% of our clients last year said that the previous living situation that they were in were unsafe. Of our clients who became homeless in 2021, 44% were homeless before they were 18. 48% experienced homelessness between the ages of 18 and 21, with the balance after the age of 22. We ask all of our clients who stay in the shelter where they slept the previous night. 31% of them are couch surfing, 23% were actually in a home, and 31% were on a street. I think this demonstrates the transient nature, especially of homeless youth. They're very difficult to count, even when the pit count is occurring, because so many of them are couch surfing and go unnoticed or untracked. In 2021, this was a brief breakdown of the services that we provided. Again, what was interesting, 35% of them had been in foster care, and only 64% have had their diploma or high school equivalency. One of the reasons we partner with the Northern Nevada Literacy Council to provide the high school equivalency courses on site at Eddie House. In the next slide, you see our drop-in center exits. We count the exits of each program individually to measure how each program is doing as opposed to how each client is doing. We view that separately. And so you can see from referrals, someone who's in current permanent supportive housing, someone who's only 36% of our drop-ins only access the day services. Many of them, as it shows, are already in permanent or temporary housing, and so we just provide, food when someone is food insecure. I'll keep going real fast. These are our emergency shelter exits. An unsuccessful exit is someone who ends up going back on the street. They choose to leave our program, or in the very low likelihood that we have to refer them to the CARES campus for a several-day suspension for behavior issues. And then in the next one is our community living exits. 45% of our clients are moved out successfully from community living to either their own housing situation or a transitional housing program. The unsuccessful folks are often moving back into our drop-in and emergency shelter program. It takes some of our clients twice to kind of figure it out. This was also based off of our old programming, not the new programming that we launched this year. You'll see in a later slide that that's better. Our transitional living clients last year successfully went on to other more permanent housing situations, 70% of them. 30% were having to be referred to mental health services at the time that they had exited our transitional living program. This year, we are actually seeing a 71% success rate from our community living program, a 100% success rate in our exiting of transitional living. We've already served 41 new clients for the first time since January 1 and 132. So we're on trend to be serving more clients this year than we have previously. That's what I have for you.
Thank you. I will go to the board for questions. And again, hopefully, if this triggers a future agenda item, maybe we discuss things more in depth at a future agenda item. So I'll go to the left of me, and Councilmember Dare, you asked for this presentation.
Yeah, thank you so much for being here, and good job. And you did get through it pretty good. I do have a couple things. Just one, kudos for the foster care portion. One of the things that I'm very interested in, and this might be a future item, something that we can talk more about in goals. I know we're coming out of COVID and everything it's changed everything. It was definitely put everything off course. But I'm a big collaborator when it comes to all of our youth services. And so it's one of the things that ultimately one of my questions is how are we working together in our youth services And I know we all do things a little bit different. That's just kind of how the nature of the beast. That's why we have different groups to serve different needs. So I don't mind that there's differences. That's one of the areas that if you could speak to. And the other one was job training. I didn't hear much on that. And to me, that's one of the key areas to help. Thank you.
Yeah, I'll answer your first question first. We work with every agency in town that we want, that is able to. Again, we have that value of collaboration. We have new agencies that we're having conversations with each and every week, even some as new as next week, in the continuum of care for serving homeless youth. When it comes to job training, that is a major focus of our programming. It's one of the 5 kind of key areas with careers and finance. We have a community liaison who's a full-time member of our staff whose job it is to identify employers within the community who are eligible or we would be interested in taking clients of ours as employees. We host those employers on our campus every week. So that our clients are able to meet with them and figure out if it's a good fit. And then that person also helps with job training skills, helps them get into certificate programs. And through that, we partner a lot with the Community Service Agency, the Community Health Alliance, and NNLC to provide some of those training programs.
Thank you.
Anything else from this side? You're good. Okay. Do we have any questions over here? Well, thank you so much, Mr. Macaluso, and looking forward to working with you on future programs. I think that this pilot, independent living pilot program is something that we should see how we could support. And I know that you're helping divert folks from the CARES campus, so that helps with the county's mission and also the foster youth. So I'm sure there's a lot of future collaboration we can do.
Oh yeah, since we've been able to get into the CARES campus, and it's been a great relationship with them, in just the last 6 weeks, we've identified 15 youth that we pulled over to in-house.
That's great. Well, thank you so much.
Thank you.
Have a great rest of your day. Thank you, Board, for keeping the meeting moving along. Next up, we have the Veteran Affairs Sierra Nevada Healthcare System Update and Presentation by Chris Sadier, VA Healthcare for Homeless Veterans Supervisor, and Kara Fracke, VA Coordinated Entry Coordinator. And I'm sorry if I butchered your names.
Good morning. Kara Fracke for the record.
Chris Statter for the record.
Perfect. So Chris and I are here from Healthcare for Homeless Veterans. My name is Kara. I am a licensed clinical social worker and the Coordinated Entry Coordinator with the Reno VA.
And I'm Chris Statter, the supervisor of the homeless program at the Reno VA Sierra Nevada Healthcare System.
So we are located right off of Wells Avenue at 350 Capitol Hill. We are a little less than a mile from the Reno VA Hospital. We are open Monday through Friday, 7:30 a.m. to 3 p.m. And our phone number is below. Our HCHV mission statement: the Healthcare for Homeless Veterans program offers services designed to assist homeless veterans to become active and productive citizens. We meet veterans where they are, provide hope and empower, change to help veterans realize their potential. At Healthcare for Homeless Veterans, we have many amazing employees at Capitol Hill that prove this mission statement to be true. They work endlessly to assist the veterans, and in the next few slides, we will cover the services and resources that we have available. So at Healthcare for Homeless Veterans, our eligibility: first, homeless services, we have different eligibility than the main VA healthcare system. Many veterans that are not eligible for VA healthcare may be eligible for our services. Some reasons that they might not be eligible for VA healthcare but eligible for us is due to length in service or discharge status. If a homeless veteran is not already enrolled at the VA, they can present to 350 Capitol Hill and meet with an outreach social worker to discuss their eligibility, or they can contact Chris or I to look more in depth into their records and see if they are eligible for homeless services. Available services at the Healthcare for Homeless Veterans: we have many wonderful resources available to our veterans. We have a walk-in clinic that's open Monday through Friday, 7 a.m. to 2:30 p.m. They can meet with an outreach social worker. We have showers available on a first-come, first-served basis, Laundry available on first come, first served basis as well. Food items and clothing items. Transitional living, which I will talk more in depth about in a little bit. And then Chris will talk more in depth about the remaining services we have available. So at Healthcare for Homeless Veterans, our outreach social workers, there's 4 outreach social workers. They are the first people that veterans will usually encounter, whether it be through the walk-in clinic or on community outreach. Outreach social workers focus on rapport building, trust, and developing relationships while engaging the veteran in services. Social workers complete extensive intakes and follow-ups to discuss housing options, goals, and barriers for the veteran. Intakes and follow-up appointments are Monday through Friday, 8 a.m. to 2:30 p.m., and they're on a first-come, first-served basis. During intakes and follow-ups, the social workers complete various mental health assessments and comprehensive suicide risk evaluations. These are done yearly or when needed. And then there is also a national call center for homeless veterans, and veterans can contact this phone number, 1-877-424-3838, and the call center routes it to our program, and an outreach social worker will reach out to the veteran to offer services and engage them. And lastly is our transitional living programs, contracts, emergency residential services, and grant and per diem. So at Healthcare for Homeless Veterans, we have various types of transitional living programs. Most of our transitional living programs are 90 days, but we do have some that are up to 2 years. They are provided by community partners through a grant and per diem and contract with the VA. We have about 140 beds across 7 different agencies. Included in the 7 different agencies, the VA also has contracts with 2 28-day residential treatment programs in Reno and 1 in Fallon, Nevada. Each transitional living program provides a support network, case management, 3 meals a day, and a safe living environment. Many veterans have success in these programs while being stably housed. They can focus on and work towards their goals, such as employment, following up on their medical care, and locating their own independent housing. And now I'm going to hand it over to Chris to continue.
Thank you. We also have a number of social workers who engage in the justice system. It's called the Veterans Justice Program. This was the initiative set forth when it was first founded. The purpose of the VJP initiative is to avoid unnecessary criminalization of mental illness and extended incarceration among veterans by ensuring that eligible veterans in contact with the criminal justice system have access to Veterans Health Administration, mental health, and substance abuse services. We have social workers who engage in mental health and veterans treatment courts in the community. They liaison with the court to help ensure that the court has access to treatment records and that the veteran has access to the treatment needed while in the court. They also work with veterans exiting jail and prison and help them transition back into community living, whether they need housing, mental health services, medical services, any additional care. We make sure that those connections are made. This is a fairly new service for our homeless programs, the Homeless Patient Aligned Care Team. Essentially, this is a primary care team specifically dedicated to veterans who are homeless. They are based out of the Capitol Hill Outreach Center. They provide a coordinated medical home, and this isn't a physical home, but more of like a home base. So when a veteran who is homeless needs medical care, they know they have a friendly provider on the team. They're comfortable with them. The provider can go out into the community. The entire team is able to go out. The team is made of an MD, a physician, a registered nurse, a licensed practical nurse, a social worker, a pharmacist, and an occupational therapist. Services are, again, provided in the community. They're provided in the VA. They're heavily based on walk-in hours. So veterans can set an appointment to see their primary care team, or they can or they can just walk in. We also provide case management. So our goal anytime a veteran walks in our door in a housing crisis is to help them resolve that housing as quickly as possible. When a veteran needs some more intensive work, we're able to refer them to some social workers who provide that intensive case management. We also have the Housing and Urban Development and Veterans Affairs Supportive Housing Program, generally known as the HUD-VASH program. This is a partnership between the Department of Housing and Urban Development and the Department of Veterans Affairs. The HUD provides a Section 8 housing voucher for veterans who are homeless. VA provides case management. This follows a housing first model to provide permanent supportive housing. We are able to get a veteran into housing, provide that case management to meet whatever needs they might have to ensure that they're able to maintain their housing. The really important thing to note on this is the expansion has very recently expanded, or I'm sorry, the eligibility for this program has very recently expanded. If there's a veteran who was previously told that they're not eligible for this program, that has possibly changed. As Kara noted, the eligibility for homeless services is wider than for healthcare. So if there's a veteran that that a service provider is unsure of their eligibility status, it would be Kara or myself could be contacted. Any member of the Healthcare for Homeless Veterans team could also be contacted to try to confirm that eligibility. Just some quick hits on data. This fiscal year 22, we've had 2,000 clinical contacts through our outreach program, our walk-in clinic, and our case management programs. There are currently 321 veterans housed utilizing HUD-VASH vouchers. There's another 78 veterans who are currently working towards permanent housing through the HUD-VASH program in some various state of applying, gathering documentation, searching for an apartment, awaiting the voucher to be issued, just some various state of one of those. And then a total of 57 veterans have been housed this fiscal year through Healthcare for Homeless Veterans Services. And that would end what we have for you all today.
Thank you. All right, I'll start on my right-hand side. Yes, Councilwoman Jordan.
Thank you very much. Thank you very much for your presentation this morning. It was very, very informative, and I'm excited that everybody's working with the CARES campus and kind of creating this entire ecosystem of information and services and really getting rid of a lot of the silos that have existed for decades. My question is for the veterans that are potentially, two questions, potentially on the cusp of homelessness. Is your agency one that can help direct them to assistance to keep them from falling off the cliff into homelessness? And two, can you assist with individuals that aren't sure of their vet's benefits? Because it seems like there's always a different entity, agency, phone number, website for everything, and they often get lost. So are you a hub that can direct them?
Yeah, so the second part of that question, we can and we do that quite frequently. Because you're right, there are different branches to the VA. There's the benefits arm, there's the healthcare arm, and we can and do help veterans navigate that as they have any difficulty with that. And then the first part of the question, I'm sorry, if you could repeat the first part of the question.
The first part of the question was, do you provide assistance for veterans who maybe are in a vulnerable, potentially falling off the cliff into homelessness?
Yeah.
Do you help them with that as well?
Absolutely. In terms of internal services within the VA, we are slightly limited. What we do is we connect veterans to our supportive services for veterans and families provider, Nation's Finest. We do a lot of collaborative work with them to kind of help avoid evictions. We help veterans navigate community resources, and we help them kind of connect internally with VA services. If it's an issue of trying to increase income, we work with them on that. If it's an issue of navigating the legal process, we'll help them through that, kind of help them wherever they can. But yes, we do provide support for veterans who are facing eviction or facing housing instability.
Okay, so if anybody in the community, a vet, has a question, they're free to call this 877 number, and you'll help get them where they need to go?
Absolutely. More directly, on the first slide was 775-324-6600. And that connects directly to our Capitol Hill Outreach Center.
That's fantastic. Thank you very much.
Absolutely.
Thank you, Councilmember Reese.
Thank you, Madam Chair. Let me say thank you for the presentation. I especially appreciated the focus on justice-related work that you're doing. I guess I want to ask a question somewhat related to my colleague, Councilmember Jordan. It has to do with vouchers for veterans to use for housing-related services. You know, it comes to mind, and Ms. Cochran would have to correct me, but the city of Reno received some assistance or a group of vouchers, but my understanding is we weren't able to use them, meaning there were not veterans who were eligible, or perhaps there were more vouchers than there were veterans that we'd identified. So I'm trying to figure out what the disconnect is there, because I think that is what concerns me the most, is that there is a resource, but it's not being accessed. Is there any way to speak to that?
Yeah, so I don't know that I could speak with any familiarity with the City of Reno voucher program that you were speaking of. What I can say is one of the things that we work really hard at in our HUD-VASH program is engaging with landlords and trying to find landlords who are willing to kind of accept our vouchers, who are willing to kind of work with us on an ongoing basis. And our team does a lot of work to try to engage veterans and find the veterans. And there is, I think, kind of an additional level of comfort with our building for veterans who are homeless, even veterans who are not necessarily comfortable with the VA in general. Sometimes are more comfortable engaging with us. We're an off-site building. We're a smaller, intimate building. You can get to know the staff a little bit better.
Well, and I think I'm excited because I know the Volunteers of America and the City of Reno are engaging in a process to take possession of the Highway 40 motel, which I think's focus will be, at least at the outset, on veterans. And so I'm hopeful that you'll work with that organization, or both organizations, to make sure that those placements can be made rather quickly. I think we have a little bit of time to sort of scale up and make those functioning. And so I'll be excited to add those. And those are roughly, I think, 36 or 38 units. So excited about that addition, 35 units. So I'm excited about that addition, again, because it speaks to a population which we believe is capable of handling the independent living facilities kind of from the jump. So I'm excited about that as well.
Thank you. Any other questions? All right, yes.
Thank you, Madam Chair.
Commissioner
Thank you so much for coming and presenting. This is one of the issues that I do see is where we have not necessarily a disconnect, but I feel like quite often our veterans get lost in the discussion in regards to that outreach and the ability to find the bridges between veteran services and human services and to Councilmember Reese was saying, how do we really connect everybody and make sure that that access is readily available? Now, with your case management, do your case managers work directly with the county's Human Services Agency to identify maybe possible veterans that are within the county management programming but have not been identified with the VA?
Yeah. So I know Ms. Fracke works very closely on the coordinated entry team and working with HMIS. And working with members of staff on the county to identify veterans who are potentially on our radar already, or potentially not on our radar, and helping to foster that connection.
Okay, wonderful. Thank you, Madam Chair.
Yeah, absolutely. On this side, Councilmember Durr.
Thank you. Question, so are you guys full at this point? Do you have room for, and I say that with a poignant question. On this, it tells me there's 60 veterans that they're serving here. I feel like with what you just told me, which I think is fantastic work, good job, I don't think we should have 60 here. And so when you talk about disconnect, I don't understand that what is happening. I know that they actually have to accept services, but that's a lot of people not accepting services. So can you tell me what's happening? Because That's an issue.
Yeah, absolutely. So I agree, and we do have the capacity to accept more veterans into the HUD-VASH program and some of our other programs. Some of the vacancies, for lack of a better term, kind of roll from time to time, right? In terms of specifically the CARES campus, we recently got an MOU completed for us to provide services on the CARES campus. So actually beginning tomorrow, we are going to have a social worker providing walk-in services to veterans at the CARES campus to try to help make that connection.
Oh, good. Okay, I would ask if we can maybe make that part, when you talk about that one, I'd love to hear that update, because to me, between our youth and our veterans, those are our areas we can do so much good, and it seems like they've been lingering a little bit, but it sounds like it's not lingering. You're doing great things. We're just missing some pockets, I would say. The other thing I would say that please continue to communicate to us also as elected officials if there's resources you're not getting. We get to work with legislators in D.C. and things of that fashion, and we don't mind going and fighting for things that need, especially on the veterans. It's one they all spout that they're ready to help, so we can make sure you have what you need. And then my last quick thing is I had somebody call me, and again, you never know the whole story, but can you tell me if this happens? We had somebody that was leaving the VA, and they said they had nowhere to go. That made no sense to me. You're walking out of the VA, and they say they have no place to go, so I'm getting called to see if we can help them. And I was confused by that. Is that an actual thing? Is there not the help needed there?
No, I mean, I think there are services we can try to get veterans into same day. We do the best that we can with the system. Sometimes programs are full, other programs have openings. Sometimes there's kind of disconnect from one side to the other. I would say if there's ever a situation that hits your radar akin to that, you can reach out to myself.
Thank you.
Ms. Fracke, and we'd be happy to try to do what we can to try to resolve that situation.
Well, I didn't have your number that day, or I would have, but thank you. They really appreciate your time here. Thank you.
Sure.
Well, thank you. I have many questions, but I think I will talk to our staff offline. My main question is, of the operators that you have operating your transitional housing, do they require sober living for the most part?
Yeah, so the majority of them do require sober living, at the very least clean and sober on site.
Okay.
So it's not the idea behind that is to not penalize somebody who might be using, but trying to kind of work through maybe a relapse or trying to work through the recovery process.
And is that a federal requirement if they're going to receive funding from the VA?
So that's specifically outlined in each of the grants or contracts that are written. So when the grant or contract is written and approved, it goes up to national office every 3 years or so for approval, and then we kind of are provided the grant to ensure that they're providing services in alignment with the grant.
But not necessarily a requirement.
It's not necessarily
flexible.
no.
Okay, that's good to know. Well, thank you so much for your work, and I'm really excited that you're collaborating with us at the CARES campus. I think that's going to be a game changer. So I really appreciate your time presenting to the CHAB. We'll see you soon, I'm sure.
Yeah, thank you very much.
Thank you. Okay. Next up, we have our affordable housing presentation by Monica Cochran of the City of Reno, J.D. Klippenstein of Washoe County.
Good morning, Madam Chair, board members, Monica Cochran for the record. So JD and I are going to kind of tag team this presentation. There was a request to get kind of a brief overview, and so I'm going to start the first part and then pass it over to JD. And I'm going to hope the clicker works because I'm already challenged with this. Oh, look at that. So exciting. The little wins. So on this screen, what we can see here are some general terms when we're talking about affordable housing. Typically, when we're talking about affordable housing, we are talking about a housing cost that does not exceed 30% of a family's income. So whether you're making at or above area median, we still want people to not be paying more than 30% of their income towards housing. When we are talking about area median income, we are talking, again, about households that are in the median middle of the given region, or in the range for the given region. These all come from HUD. You know, HUD is our leader in all of this. And they send out these annually. We get new FMRs, we get new AMIs, everything that has to do with the grants that go towards this and eligibility. So the low income affordable housing, I think this gets confused a little bit because we have some different terms. We have housing that's affordable and we have affordable housing. We're in two situations right now, you know, a perfect storm. So when we're actually talking about affordable housing, we're talking generally about those households at 60% or less than area median. So what does this look like? So what we can see here is this shows the area median income for a family of 1, 2, and 4. And we throw these out all the time, and so we always get asked, well, what does that look like in dollars? So right now, for a family of 4, and this is the one we typically use just because that's how HUD releases all of the information, the AMI for a family of 4 is $83,800. So when we're talking about affordable units that are getting built, the 60% units, these are for a family of 4 that are making about $50,000. This slide, we break it down a little bit more with hourly wages and rents. So when you look at what 60% AMI means for a family, you can see from a single person to a family of 4, that ranges between $17 to $24 an hour. I'm going to skip the affordable first and go down to the average. So Q4 2021, this is what average rents look like in our region. So there's a studio, 1 bedroom, 2 bedrooms, and 3 to 4 bedrooms. When you go back up to the affordable rent, this is what a 60% unit would look like for the same family, the same unit, which is a big difference, and it makes it a lot more affordable for a family in where they're not going to be housing burdened, paying more than 30% of their income towards housing. So this slide is information that comes from the Truckee Meadows Regional Strategy for Affordable Housing Plan that was done back in 2019. And of no surprise to anyone, I would imagine, is that there is a shortage of units and we need more affordable units. Is there anything else you want to say about this? Okay.
This is a big.
I
would add that.
Go ahead.
Nevada has the largest gap of any state in the country in terms of rental units that are affordable for low-income renters. So this is acutely felt in Washoe County, but is absolutely something that the state is struggling with as a whole.
Sure. I'm going to let JD take over right here because this is where the technology is going to come in.
I think so. I think it's all right.
I'm
going
to
roll with it.
Okay, you roll with it.
Good morning, board. JD Klippenstein, Housing and Grant Specialist, Washoe County, for the record. Obviously, you've been at the center of a bunch of move around in terms of who's doing what, and we thought it would be good to have a conversation about the housing continuum and kind of who's on first, what some of these regional roles look like in terms of the local jurisdictions and where maybe the leadership or focus is going to be moving forward. So I originally designed this slide to have some fancy click-ins. Those click-ins aren't there, so we're going to roll with it. So on the left-hand side, or my left-hand side, hopefully your left-hand side, you're going to see kind of the starting of the continuum around emergency shelter, transitional housing, all the way through home ownership. In particular, we want to see the county, as they've moved in with the CARES campus, but also in general around being the lead entity for the COC and taking on homelessness as a key issue. Moving forward in terms of this housing continuum, the county would be focused on what does it look like to support and strengthen our emergency shelter and transitional housing programs, as well as investing and engaging with stakeholders to increase permanent supportive housing options. I want to make this really clear. Sometimes transitional and permanent supportive get thrown out as if they're the same thing. They are not the same thing. Transitional often it's a temporary thing. It's 6 months, it's 2 years. Sometimes means that they don't have a lease. They are getting supportive services, but that isn't necessarily their home. Permanent supportive housing is a best practice, HUD recommended, those same services with a lease, permanent housing, as long as that person can stay there and is often subsidized or provided with other housing assistance to maintain that housing. So moving forward, we want to see Washoe County really taking the lead around emergency shelter, transitional housing, and then permanent supportive housing. And then I'll let Monica do that.
Sure.
Click over, and then I'll pretend like the yellow button or yellow square.
Okay.
Goes
Well,
from there.
we're just going to go with
Yeah.
it. Okay, so as JD mentioned, the left side of the slide is more that coming out of shelter into transitional and permanent supportive housing. Then we get into where the city has identified through our housing special meeting. I presented a strategic plan as far as housing for the division and kind of what lanes we were recommending we focus on our side as the lead of the Washoe County Home Consortium. And so at this time, we're really going to be focusing on, I guess, the right side of this continuum in the 30 to 60 a little bit, and then the 60 to 120, which is a lane that we haven't operated much in the past, but it would be some workforce housing. That housing is not as subsidized, so it's a little harder to make happen. Most affordable units really pencil about that 60% mark, and so these are the areas that we're really trying to increase our efforts on with some of the Home Consortium projects. Also thinking of some other projects for affordable, and then with some of the ARPA funds that have come forward, we've supported some projects in that income range also. I can say with the Home Consortium, the city is the lead. The way that works is there is a technical review committee, which is comprised of regional,
The jurisdictions.
yeah, a representative, from each of the jurisdictions. So Sparks, Washoe, and Reno are on that committee. Applications come through each year. They're reviewed, evaluated. Recommendations are made to the managers, who are the managers of each of the 3 jurisdictions, and then it goes to regional for approval. So it is definitely a regional approach, and there are units that come up in each of the jurisdictions. I would also, just like when we were talking about the need, I would like to give us a little shout out that last year the Home Consortium approved funding to go towards over 700, I think 716 new units. And it looks like with the applications that are in for this year, if they are all approved, it will be almost 1,500 more units. Wow. So double what was approved last year. And then we're working on some projects that really line up with trying to move people from obviously the left side of the continuum all the way through home ownership. So we're working on some projects for housing preservation also, and moving folks into home ownership.
I have a quick question for you. This is a great slide. This really kind of boils down who's in what space and getting really focused on bringing to market the housing that we need across the spectrum. What I can't tell, but I'm guessing I can tell, that there's a crossover between Reno, Sparks, and Washoe County under that big yellow circle, oval. Is there any way that we could get that slide without that yellow oval on it?
Yeah, absolutely. I put the slide together, so we can definitely, it was the click-in piece there.
Because
But yeah.
it looks like there's clearly emergency sheltering and transitional housing and permanent supportive housing seem to be largely in the county space, and then, but crossover into affordable, and then upper end is on the city of Reno's and Sparks' side.
I can speak
correct?
to that a little bit, yeah.
Okay.
Councilwoman Durant, really with the Home Consortium is kind of the vehicle for the jurisdictions to coordinate, and home funds are grants from HUD, and with a huge emphasis on what we might consider permanent supportive housing, or providing subsidy for housing that is affordable for folks that are at 30% AMI or lower. And we also think there's a considerable amount of overlap in terms of the permanent supportive and affordable rental housing space, in which jurisdictions can be thinking about local policy that helps incentivize or bring more units online in that regard. So definitely there's roles to be played, but in that space, it's a very multi-jurisdictional effort in terms of the Home Consortium and policy.
This is great, just getting that yellow
Yep,
bubble
I got it.
removed. This is a great visual representation. Thank you.
Yep.
Absolutely, and I think that one piece that may be missing from this, not to critique the slide more, because it's a great slide.
Oh, go for it. I'm not attached to the slide.
We all have a role in policy for affordable market rental housing as well. All the jurisdictions do.
Yeah, I would say absolutely that because the jurisdictions are so closely intertwined on that, thinking through policy in each jurisdiction, I think I would say City of Reno has a policy that's incentivizing affordable housing. Other jurisdictions to think through how that same kind of incentive can be in place for units that are trying to be built in that jurisdiction. We're actually going to talk about that in just a little bit. But I appreciate. I'm going to make a note on the slide.
No, you're fine.
And I'm going to keep moving forward unless there's other questions.
Keep on trucking.
And I think there's a historic opportunity in front of the jurisdictions and in the region that we thought is a good goal for us to think through. How are we going to lean into that continuum? How are the jurisdictions going to work together? Who's going to take lead where they need to take lead and bring the focus where there needs to be focus? And that's in regards to a historic investment that the governor has proposed for some of the state ARPA funding. It's $500 million of the state's, I think, 2.7 billion going towards affordable housing. I should be clear that is pending the Interim Finance Committee's approval. The first half of that's on April 7th. But the governor and the Housing Division have laid out that this funding, about 300 million of it would go to developing new multifamily units. 130 million would go towards preserving existing affordable housing. It's a huge challenge in affordable housing that affordability periods expire and that housing goes to market rate and you lose housing. So it's a challenge in our region and our state. So 130 million would go towards keeping affordable housing affordable. And then the balance there of 30 and 40 million would go towards increasing home ownership opportunities, as Monica spoke to a little bit, as well as 40 million for land acquisition. I want to make this part really clear because I think it helps us clarify what our roles are. This funding likely, I don't work at the state, so I can't give you, but it is very, very likely, it was strongly hinted at from conversations we've been in, that it's going to live at the housing division. Or the hope is that it would stay at the housing division, meaning that jurisdictions don't draw this down further. The funding would live there and developers would directly go to the housing division to access these funds. So for us in Washoe County and Truckee Meadows is thinking through, well, then how do we help projects get aligned in the best way possible to access this historic investment? This is like a century's worth of grant funding, on right here versus what we normally see coming into the state. So it's a significant investment and opportunity.
Chair, I have a quick question.
Yes, Councilman.
Yeah, so when you say housing division, I want to understand because I know that past is reaching us now, and if you look here, Spark somehow is not part of this, but we're a part of this, and then we're part of that. And I don't know why we got there or whatever, I don't care. But I'm talking now in the future, what needs to be there. So if that's the case, who makes the decisions? Are you saying Reno Housing is going to make decisions for that? Who's the group that you're saying
The
makes?
Nevada Housing Division.
Nevada Housing Division.
So it would not even come down to any decision making, we get to make it all. And you're saying that's the good idea.
I'm saying that that's what's going to happen.
Gotcha.
So mostly it's trying to figure out how as jurisdictions and as leaders we work with all the different stakeholders to help that grant funding come into the community, or that financing tool rather, how to support developers and projects access that funding.
Thanks for the clarification.
Yeah.
And I think what's, could be exciting potential about this is that I've had some talks with some developers who do want to get into the home ownership affordable housing. And I've been able to push them to JD, and JD is going to help them through the process. So if there is projects like that you want to facilitate, then I think that's the opportunity to do it through staff, through the state of Nevada.
Yeah, and I would say that Steve Aycroft, the administrator for the Nevada Housing Division, had a meeting with local jurisdiction. Monica and I was there, Amy was there as well, to think through what does that look like. And really this is what we're talking about is coming from this conversation that jurisdictional staff have had with the Housing Division to better understand what this is going to look like, so we really know how to support the community and the projects that could come online through this funding.
Great. Mr. Mayor, you have a...
Yeah, my question is, number one, 300 million sounds like a lot of money, but really that's probably about 500 apartments. Divide that up around the state. There's not a lot there.
I would say that this, affordable housing tends to be, it's like lasagna, right? It's like multiple stacks, right? So this isn't the only financing tool that would be used. I can't give you an estimate on units, but it's much more than 500 units that would come on, because there isn't a single project that would solely rely on this funding source. There would be bonding and other kinds of capital financing brought in. This would lower that investment, so it could be affordable for folks at 60% AMI or lower.
And so the other question is this in perpetuity or is this a limited time? Because we've seen what's happened in Reno, did a lot of affordable housing in the 2000s, the early 2000s. That's now come offline and gone to market rate, which is helping our rents go up, largely because those are now market rate apartments. So is this a set time frame like the previous programs?
I'm not sure what the state is going to put for their period of affordability. I would assume that it would be at least 20 years. But typically when we go through the home consortium, we do 30 years for the home units.
And also, the low-income housing tax credits are another tool. Those have 30-year,
Yes.
they tend to have 30-year affordability periods. I don't believe that the affordability periods have been set, and the conversations that we were in hinted that it would be kind of baseline would be 30 years, perhaps more with these funds.
I think the longer the better, obviously. We're trying to work to where we can give away land to build affordable housing and stay affordable forever and stay at the 30 AMI to 120 AMI, which to me is the real solution for long-term care, and then have a maintenance program that goes along with that. But it's, to me, we're just kicking the can down the road 15 to 30 years, whatever it is. And we saw what's happened in the last 5 years. I'd like to see some more long-term solutions than having that come off. Because in essence, we're giving a break to these the developers, and that money's going straight in their bottom line at the end of the day when they sell it at market rate.
And I think there are some models that have been coming forward lately where the land stays affordable in perpetuity. And so there's some deed restrictions, and that's some other models that we're also looking at.
I also say it's a perfect tee up for the next slide, Mayor Lawson. Unless there's other questions, we can jump into that.
Continue on.
All right. So we wanted to come to the Community Homeless Advisory Board and talk about some potential next steps, some things that the jurisdictions can be thinking through in order to leverage this $500 million in state ARPA as much as possible. And really, the way to think through this is how are we building a more robust policy and financing toolbox regionally, not just what comes from the federal government or from the state, but what, as the jurisdictions here regionally, what can we be putting in place to have those tools ready to go? And we have kind of three categories. Mayor Lawson already spoke to one of them in terms of land, but we want to think through policy tools, exploring policies such as fee waivers, which the city of Reno currently has in place, parking requirement reductions, density bonuses, and other tools that can increase the stock of affordable housing. So some of the tools that local jurisdictions have now, what can we do to support affordable housing through that? And again, when we say affordable, we're talking about 60% AMI or low. We're talking about low income affordable housing here. There's also definitely conversations we can be having, jurisdictions can be having with stakeholders around how do we increase land availability for affordable housing development and ensure that that affordability remains in the long term. Land trusts, deed restrictions, public land inventory, seeing what land's there. Really, there can be lots of collaborative work done in that space with jurisdictions and other stakeholders. And then the last thing that we wanted to highlight was thinking through the process of how can we fast track affordable housing through permitting and the construction process moving forward, right? It can oftentimes take a long time to get through permitting, through all the different processes someone has to actually break ground. And there are other jurisdictions that have put programs or staff or other practices in place. When a project that's going to build affordable housing comes forward, they are supported through that process to get through it as fast as possible so that we don't have delayed timelines. This is particularly pertinent with the cost of construction being what it is now, right? Projects are, the longer it takes to be able to say yes to ordering the concrete or ordering the lumber that's needed, the likelihood that the price of the project is going to increase sometimes beyond what can pencil out. So timing is a really important part of building affordable housing as well. So we wanted to bring these forward as how the ways that the jurisdictions can be moving towards that 500 million in ARPA, the tools that we have or the tools that we need to build in order to make sure that those funds flow down into the community. And I think, Monica, is there anything else there?
Nope.
I mean, that's it. Last slide.
All right. Thank you so much. I think this is a really exciting challenge for all of us to work together on how we can look at, changing our policies, look at our inventory of land, and how we can support, those fast tracking of housing options. I'll go to my left first. Y'all have anything else?
I just have one quick thing with the vouchers. We just got back from DC for some meetings and listening to them talk about that they believe they've fixed the problem that we had years ago of because they said you could use multiple vouchers or something in that fashion. Are we finding what I thought I heard in DC to be true, or are we still having that policy issue from DC that the voucher doesn't, our housing's too expensive for the voucher and now they don't really work for us? Or can we call and actually, they said something, there's a number you can call and they will expand the amount to reach our need. I don't know if it's true because I did not hear about it here. I've only heard about it when I was on that trip.
I can say the vouchers come into the Housing Authority, so they are the expert as far as it comes to vouchers. What I can say is that when we are paying for any type of rental assistance for a client, in any way of any funds that come down through HUD, we can't pay more than FMR. And so HUD sets FMR every year, the fair market rent. And if somebody's in a unit that is above that, then we can't help them. Through COVID, there were some waivers where we were allowed to kind of fudge that, but those waivers have since expired.
So I brought that up in a meeting, exact what you just said. And, well, you said it better than me, but that's the idea of what we said. And they said that that people can call and that can be expanded depending on the region or what is happening, according to some meeting I was in, and HUD was there.
We'll look into it. I know that there are, the Housing Authority has the ability to get that raised a little bit. They're the only entity in this jurisdiction that can do that, but it's complicated. I don't completely understand it, so I can work with them and we'll see what we can do.
It might be the help we need. Thank you.
Mm-hmm.
And I would add, the level of rent increase in the community is significant, so it's probably hard for our process to keep up with it entirely. I think this year's 13% increase just alone in rent. It's been a doubling over the last 10 years, so it's probably difficult for the vouchers to keep up with just how quickly rent is increasing in the community.
Do you have anything, Mr. Mayor? All right, over here, Councilman Reese.
Thank you, Madam Chair. Thank you for the presentation. I thought the last two slides were particularly instructive, and so I want to focus on those. The first thing that is my concern about the money that is allocated through the ARPA funding process to the state is just what portion of those will come to Northern Nevada. So in my mind, it behooves us all as regional partners, and we all are partners on this dais, is to make sure that we are engaged quickly with the state on projects that, for lack of a better word, I'll call them shovel ready, so that we can make the most of the dollars available before they get gobbled up by our friends to the south. For our part, I know that we have, like you said, Mr. Clemenstein, about the layering, the lasagna effect. The Highway 40 motel is an example of that, where the state is, I hope, coming to partner in the capital stack for how to finance that, along with the expansion of the Village on Sage Street. Both of those projects require a commitment from both the city and from the state, and so we're sort of waiting on those. I think for folks who might be in the audience, I know that Eddie House has some ideas that I think would be in that vein. NYEP is working on an intergenerational living model, which I think is a good one. I spoke over the weekend with the Justin Hope Foundation about a specific project that they have that's in the county. So I've sent them to your direction, Commissioner Hill, in part because its focus is on people who have various health or mental related disabilities, and so they want to find a way for permanent solutions for independent living for folks who are in that area. And so again, more than anything, I'm just suggesting that with the cap stack and the layering, the lasagna effect, if we're to do and get some of those funds very quickly, we've got to move quickly, I think, as a region. So your presentation is very timely. The only other one that I'll put out there is the Domestic Violence Resource Center is also an organization that is, I think, looking at ways in which they might find both I suppose it would be transitional housing really is their focus, but I think they're another organization that has a lot of worthy opportunities to help us keep folks from becoming homeless. I didn't fully understand the potential next step slide, the bullet point number 2, which says explore options to increase land available for affordable housing development. The practical reality is we don't make more land, right? We live in the Great Basin where we've quickly run out of land or are running out of land. So other than the fact that I think the jurisdictions may own land, or perhaps with RTC, who owns a lot of remnant parcels here and there everywhere, I think this is an interesting question or component of your presentation. So I didn't know what you might say to speak to that particular part. For the city's part, I think our position has been that if we own the land, let's talk, right? Because we're looking for people to come in with ideas and partner with them. And then, of course, our idea is to keep it in affordability in perpetuity, as Ms. Cochran indicated. Sometimes developers aren't super interested, committed to a 30-year, affordability criteria. So I'd like to know what your thoughts are on the land component.
I can speak to that unless you want.
Go ahead, I'll fill in.
Okay. Well, first, Councilman Reese, absolutely. The use of public land, I think, is really important. Another component of that would be the lands bill, the conversations that are happening with possible federal land being in that mix. I also think it's about land use, right? What kind of zoning are we putting in there? What kinds of, when it comes to density bonuses, infill, the creative use of land that is probably closer to the urban core versus development that might be further out. So it's not just the physical land, but it's also the way that we're thinking about land. And again, when it comes to the deed restrictions and using land as a way to maintain affordable housing in perpetuity. So those are the things I'd add. Monica?
No, that's exactly what I would have said.
Okay, Commissioner Lucy.
Thank you, Madam Chair. I do appreciate it. Ms. Cochran and I'm sorry, JD, Mr. Klippenstein. I think it's what some of the slides that you put up are very, very telling of what the challenges that we've experienced, and this board has been instrumental in regards to finding the ways to truly create that transitional program and that foundation for us to move forward. And I had a unique experience with Councilwoman Bybee and Chair Hartung last week to sit with Mr. Bonifant at the university to talk about housing and some of the challenges that we see within our region and what, based upon the census. And when you really look at some of the slides that he had presented to us in the changes from fourth quarter of 2010 all the way up to fourth quarter of 21, we had significant in our vacancy rates of around 8% in the fourth quarter of 2010. Those vacancy rates are now below 3% for a number of individuals. And at the time in 2010 in fourth quarter, you saw average rent trends around $800 to $850 for an apartment or a unit for these individuals to be in, which made it a little bit more economical for individuals moving in and for the municipalities to find that true transitional housing. However, at fourth quarter 21, we're looking at that with that 3.18% vacancy rate. You're now seeing average rent rates of around $1,600 for that same unit that was available for $800 back in 2010. And so when you talk about that type of those types of numbers, it makes it very challenging for us to continue to work on those types of housing. But I think what we've done, and I think as municipalities, we've worked very hard together to identify everybody's real role in this. And that's what this board has done a phenomenal job. And to Councilman Reese's point, we work very well together. And I think that over the last 4 or 5 years, we've shown the willingness and dedication of every municipality to really address this moving forward. And there's a lot of work still to be done. And I want to make sure, and this is more of a statement to the success of everybody coming together and really identifying how we can address these issues going forward, from law enforcement to housing to programming. It really makes a world of difference. And then you look at the census, some of the census information that we have received as of recent, a lot of these individuals, when they are moving here from different communities, and in a lot of the seed communities that are moving to us are from the couple of counties that are the number, top one would be obviously Clark County is the number one with a number of individuals, but you look at Los Angeles County, Sacramento County, Santa Clara, Alameda, Contra Costa, Douglas, San Joaquin, Placer, San Diego, and Riverside being at the top of those communities moving into the area. Yet the jobs that we have here within the region and realize that we're experiencing where across the nation you're seeing unemployment being higher than what we're experiencing here within the region. In the region, we're seeing unemployment right around 2.3%. And when you talk about that type of unemployment, yet our wages do not match the income needed for these individuals. And the sad thing is one of the most challenging things that he presented to us is that for individuals, percentage of single earners that are qualifying with the income qualifying for the types of housing that we have these days, for a single family rental, only 1.2% of our current population would qualify under a single family income, and about 47 would qualify under a two-family income. And so, apartments and townhomes and condos are not much different. So when you talk about the complication of wage earners to the availability of housing to those that are experiencing homelessness, it really does provide a problem. However, the outlook is positive for Washoe County as a whole because there are jobs available. It's just making sure that we are continuing to provide the services needed and really trying to make sure that true transitional from the emergency and permanent supportive to truly that step of that 30 to 60 AMI from that permanent supportive housing to affordable rental housing. And I think Mayor Lawson and the City of Sparks has worked diligently to continue to find those public-private partnerships to advocate for that type of housing. The City of Reno has done a tremendous amount of work. All of our community foundations from the Eddy House, the CARES Campus, Hopes, VOA, Our Place, the apartments on Sage Street, on and on and on, are diligent in really trying to identify this problem and identify the housing. And then I think that next step really is providing that programming. And I want to commend all the work that both of you have done in your respective roles to help identify, work with Reno Housing Authority to try to figure out that next step. But for me, it's really, we've still got to continue to work because we're in a period of what Mr. Bonifant would consider a time of exuberance, where we're seeing that people are purchasing homes or renting homes in a state of financial benefit versus those that are just utilizing it for residential use, and that is a challenge. But I think with the addition of housing units, and if you really go back and take a look at what we've done, we still are not at the numbers that we were in 2006 after the bubble. We were probably between the three entities adding about 5,000. In 2005, we were above the 5,000 units, and most of those were single family and just a few multifamily. But we've really made a shift in all three jurisdictions in the last 3 years to make sure that multifamily has truly been a focus, and an affordable product has truly been a focus of every entity to provide that access. And I want to continue to urge this board and all of our municipalities to continue to work not just towards a multifamily unit, but more of an affordable workforce housing unit so that we can truly do that transition. And I think that really comes down to planning, not just providing the housing, but providing the housing close to services necessary, whether that's transportation, whether that's a steady employment, something of that nature. That is really what we need to continue to work on. And we're looking positive. In the next year, we have 5,970 multifamily currently under construction. And so when you see that type of impact and dedication from the private sector to deliver product, we'll start hopefully seeing a flattening of our supply and demand that will help us move forward with some of the projects that the communities are working on to provide that housing. So I'm optimistic. That doesn't mean that we've crossed any gold line, but we need to continue. We're still short of that 5,000 mark that we were in 2005. And when you have that kind of recession that we're still trying to come out of, I think it's important. So thank you, Madam Chair. I just want to add that narrative.
Thank you, Commissioner Lucy. Very true. Councilwoman Jordan.
Thank you very much. Thank you again for this presentation. And I think this is probably without question the number one priority within our region. And I know all jurisdictions are looking at how to, as quickly as possible, increase units across the entire spectrum to help meet the critical need that we have in our community right now. What I feel is missing, though, often from these conversations, we are reacting to a situation in which we're in. But if you start to peel the onion back, you start to look at the flaws that got us here in the first place. Some unavoidable. There was the crash of the economy. The developers were very concerned about building in advance. In the event the bottom fell out, they'd end up with units that they couldn't sell. But the realities is that our tax structure is broken, and that it all kind of goes back to our tax structure being broken. And unless and until we start swimming in that direction as a region, saying that holistically needs to be fixed, we are going to be in this perpetual boom-bust sort of scenario, and we're going to be reacting. And that's frustrating because nobody wants to tackle the tax issue. And, we continually attract. We are a beautiful region. People love to come here. We give great incentives to many, many large businesses. None of those incentives are balanced with a understanding that they will assist with the housing productivity and building. And so we're in this situation, and we keep talking about how are we going to fix it? We got to get down to the root of it. And so I'm just going to put that out there as a fiscal conservative. Our tax structure is just horrifically broken. And I do think, though, there are some opportunities when you look at ways to fast track things. And I do agree. If you're coming in with some level of affordability, whether it's the number of units within the project, whether it's the project itself. I had proposed at the City of Reno a number of years ago kind of like a metric or a scale that said, if you're building an X percentage affordability project, you get this X mark on fees. And then if it's an infill, you get another check mark, and that lowers the fees, and the scale keeps going down. And if it's a rehab, it goes down further. And if it's a lower AMI, it goes down even further. And that way, everybody in the space understands what they're looking at. In other words, they're not hopscotching around of not knowing what they're facing. I also don't think that plunking all affordable low-income housing in one neighborhood, in one jurisdiction, oftentimes even in one building, is a smart move. So I would like, if we have an update on this as you come back, if we could get a snapshot of where jurisdictionally the affordable units are, that would be really helpful to just understand. Back to the sliding scale, is it on a transit line? It gets another check mark that helps in that. Yeah. That all being said, we also hear from the development community with the exorbitant costs of labor and materials and just the delays of everything, that we could give the land away and we could waive every fee and it still wouldn't pencil. but then we hear from others that say, no, that maybe that's not true. So we just have to wind our way through that. I just think we all need to get real about coming together to encourage our state legislators to fix our broken tax system and stop this boom and bust cycle that we're in. Thank you.
Well, and Councilwoman Jordan, that excites me because the commission definitely wants to take a active role in the next legislative session. This is the time when we're planning what our strategy will be. And I think if all three jurisdictions came together with something, a proposal to the state, I think it would be quite successful. So we should definitely work on that. And then I would say to Councilman Reese's discussion of all the different nonprofits in town who want to work with the state on their funding measures, I had talked to Christine Hess at the Nevada Housing Coalition, and she said she'd bring all of us together, maybe before we submit, to make sure we all know what we're doing. Is there a potential to work with them on that?
Yeah. Both Monica and I participate on the policy committee for the Nevada Housing Coalition. There's lots of jurisdictional participation. I think it's a great idea.
Mm-hmm.
I don't know. Anything else you want to add?
No, I just said statewide.
Yeah, it's statewide, yeah.
Because I think if it's approved by the interim finance committee in April, we got to be moving. So hopefully,
into this week.
Yeah. Okay. At the end of this week. So, maybe there's potential to ensure that we all know what we're doing. And I think an update is a great idea because I know that there's going to be some policies that will come before the Board of County Commissioners as well. And so we can talk about what we're doing. And also, I think Councilman Dare brought up a good point. We need to have the City of Sparks with us at the next presentation as well. Yeah. So anything else from the board? All right. Well, thank you so much, and we'll hopefully see you in a few months.
Thank you.
Thank you. Okay. Next discussion is the board update and discussion on the Nevada Cares Campus Emergency Shelter, Dana Searcy, non-action item.
Good morning, Dana Searcy, Washoe County. Well, I think as we are approaching the 1-year anniversary of the CARES campus opening, what we're really seeing is that a lot of the things are we're slowing down, and a lot of the easy fixes have happened, and we're seeing some positive things, and that's good. And now we're really working on that foundation for the future, and how do we really start to turn this gigantic ship towards the direction that we have been starting to turn it, but just more time between progress that we're seeing. But a lot of this will look familiar. I'm going to go very fast. I know we have more on the agenda, so I'll leave time for questions, and I'll address a couple of the things that I know have been some hot topics over the last couple weeks. Still, our training and staffing is our number one priority right now. Safety and security, the facilities themselves, and the ongoing prep for the construction, and then also partnership development. We'll go over all of these things. Mod Pods, they are all in place. We, on Friday, moved our safe camp out of our garage and back over into the Mod Pods. They are all now in there and decorating and having fun. So that was pretty exciting for the team on Friday. Also, our winter overflow was closed on April 1st, also Friday. We've been watching those numbers pretty consistently, and what we saw was about what we see every year in mid-March as the temps start to warm up a little bit. We had beds begin to open up. So mid last week, we had a 7-day average of 21 open beds inside CARES, and so we did make the decision to go ahead and close the overflow. Our warming center with 112 capacity is still open for anybody who needs a place to get out of the cold. We will keep that open for several more weeks as we wait to really get into those warmer temps. Partnership and volunteer development continue, and recruitment efforts continue. We'll share a little more on that. And our shower buildings are in place. There's currently a three-stall shower building for the women. We have a 5-stall coming in a couple of weeks, and that will be in place through probably January-ish next year while we're waiting for the completion of the new bathroom and shower building. and the operator RFP we will also touch on. I'm sorry to say that I do not have an update. We really did hope to have an announcement this morning on who the new operator will be. We're close. Any day now that news will drop, so we will share with you as soon as we hear that. All of last week was the evaluation period, so like I said, hopefully today, tomorrow, Wednesday should be the latest. Our service providers and partners, this continues to develop. You heard from other presentations today, both Eddie House and the VA both have MOUs in place to be at CARES. They're going to have teams at the campus helping to support the efforts. In addition, our volunteer program tomorrow, Bonnie Weber is hosting a meeting between our team and the interfaith group, and so we're looking forward to really launching the volunteer program. We've had a couple more tick on, still focused on food service, and there will also be volunteers helping with mail, which have been, I should clarify, they have been helping with mail, but as we get ready to transfer that over to the campus. We've seen a couple upticks here. One, we're saying that we have operationalized our performance measures. That's that stat pack that we're going to look at again and will eventually be emailed out. Again, all things are in process, but it is up and operational, and we are using that data to make decisions. And then also our staffing case management process improvements. That one we're moving over into in process. On the staffing front, we're looking okay, and I'm happy to announce while we were very cautious and cautiously optimistic about the case management recruitment, we had an overwhelming come out, and I want to be part of this new team at CARES Campus. So this week, we have our lead. All 3 supervisors are in place. That's 4. The 4th one started today. And this week, we're doing reference checks and working through job offers for 17 case managers. Yes, so very exciting. They'll be working very closely with the VOA case managers. I'm not confirming any numbers here, but I can tell you that I'm very pleased to see that many of them did apply. Most of them are on this team, and it should be a very smooth transition. I will add, mental health counselors are hard to come by. So if anybody knows of anyone out there who really wants a challenge, this is it. These numbers, again, were no surprises here. That unduplicated clients, we see that continue to reduce. One reason is that the overflow was open and some of those clients were over there. This is race and ethnicity. Veteran status, I do want to stop here and address. I know this has been a big topic. So part of the good thing about pulling data and looking at this data is addressing the data. So when we shared this over the last month with what the vet numbers really do look like, we had our counselors, our case managers jump in and see what's going on. So one, to clarify, this is self-reported. This number is now at 34. It is not 60 anymore. The March 30th number will be, March 31st is sitting at 34 vets. So about 35% self-reported. Turns out they are not, we cannot verify their status. We'll continue to work with them. And then also we got that MOU in place, and the VA will be on site each week, and that will really help to see this needle move, and we'll address that. Same here with the TAY group. As you heard from Trevor, we'll be working really closely with him. You know, inside the campus, similar to many other programs, what we hear is that I can't go to that other program, and so CARES Campus is my only option. So we're looking forward to working with Eddie House and their team for what's really going on. You know, is that just, again, a self-reported, I don't believe I can go to Eddie House, or have people really been asked to leave for behavior or that kind of thing, and how can we help with that? So women, TAY, veterans, we're always looking for what are these big groups that we can throw some support around and work with our partners and get people out of CARES and into a more appropriate option. These are exit from CARES. and exits from Safe Camp. Again, I'm not going to go through these, but these are the two big numbers that as we throw all these resources and staff at the campus, we're really hoping to see these numbers improve. And then again, up next, nothing new here. You guys have heard our construction preparation continues. Right now, we are tentatively set for a shovels in the ground on June 1st. We have a lot of temporary buildings coming in, a lot of coordination with Hopes. Our Safe Camp will begin construction in May. Our CARES campus will start June 1st. Hope's Clinic is also intended to start during June, and we still have Ames over there on that very north corner. So there will be construction on most of the campus, and there's lots of preparation involved with that. Also, moving community mail, we kind of threw this out as a tickler last time we met. That's getting very close. I think we're about 2 weeks out. There will be a very long kind of overlap, I shouldn't say very long, but 2-week formal overlap period where depending on where your mail was delivered, we will make it right. And we're working very close with the Restart team to make sure that whether mail arrived at Record Street or CARES campus, we will make sure that it gets to the right place. But community mail, again, will move from Record Street down to CARES campus. That will be for everyone. And then our community dashboard, I know I keep trying. We keep trying. We're going to get better. I do believe we're getting better at having it posted each day by 9 a.m. We're still working towards that automatic live bed count. First automatic every day so that the weekends show up, and then ultimately live by minute to minute so that at any one time you could look and know if there's a bed at CARES or not. And then another one that I'll add on here is our operator transition. As soon as we do know the results of the RFP, we will have a big transition coming up leading up to that July 1 official changeover. And so, we're doing a lot of prep on the back end. Case management, bless you, case management, the counselors coming on board. The RFP for the medical support will drop anytime, I believe about a week out maybe for that. And so really what does that look like? Again, all these different partners, we're going from one main lead to lots of different partners working together seamlessly to make sure that whatever the need is, we're able to address it at the CARES campus. And I'll stop there and answer, I'll add, one more thing. We did talk to John DeCarmine. He will be out here during the May, June, late May, early June timeframe to help us through this transition. And then we have asked him as requested to help us maybe after that transition to come forward with an update on how we're doing.
Great. I will go to my right. Any questions over here? Yes, Councilwoman Jordan.
Thank you. Thank you very much. Okay. Are you allowed to say who put in for the RFP, or do you have to keep that under wraps until you announce?
I cannot say anything.
Okay.
I tried to get it out of her as well.
I know you're not, it's not saying who got it yet. I didn't know if you could tell us who put in for it. But if you're not at liberty to do that, okay, then.
I can confirm there's more than one.
Okay.
How's that?
That's more information than I had 5 minutes ago. Thank you. So when you talk about the RFP for the medical support, can you explain to me a little bit what that means? It means as Hopes is being built, and I would assume at some point when Hopes is finished, they would be the medical provider for there. But this is for now, like if there's medical issues on campus, rather than REMSA getting called multiple times every day.
Yeah, so very much like the lasagna idea, what we're working through is a layered approach for medical support. So how do we get this lift off of Reno Fire and REMSA, really, and our sheriff's office as well? So the idea is to, we have a lot of different things happening. We have a lot of different partners. We've got Dispatch Health, the MCOs, we've got Hopes, everybody kind of has a little niche. And, if you have certain insurance, you can work with this certain provider. So we have lots of those coming on site. Many of those MOUs have just gotten into place. We're bringing on a temporary building that will be dedicated just for like a clinic atmosphere. I mean, again, not running water and all of that, but just for medical support. So we can have a rolling schedule of who's on site on Monday and who's on site on Tuesday. And Hopes has been at the table and we're working to get them on site. On top of that, with REMSA, we are pursuing a dedicated nurse call line. This will be both for CARES and also for our place. And the idea is if we're getting a 911 call and we don't know what the issue is, we're sending all resources because we don't know. If we can get to a nurse who can help us quickly triage, they may be able to say, this is not an emergency call. They might be able to say, send an ambulance, but save Reno Fire the trip, that kind of thing, so that we can just get an expert talking to staff and assessing the situation and reduce the amount of staff going into CARES as quickly as we can and make sure that we're getting the support. One of my favorite examples was a call went to REMSA because somebody needed oxygen to be able to make their court date. Nobody knew how to get an oxygen tank. So those are easy things that we can address. And the nurse for us right now is truly because of the need, and I shouldn't say nurse. We're looking at EMTs, nurse, an aide of some kind. The medical need on the campus is so severe at this very moment that we're just going to bring in some extra help until HOPES is set up. We're working on what a walk-in clinic without the need for appointments, that kind of thing with HOPES really does look like in the long term. But yes, until we get there, this will give us a lot of information about what are the needs, how massive are the needs, that kind of thing.
Okay. And then my final question, and I don't know whether I would have this under board for a future meeting because I don't know how the next agenda item's going to go and when our meetings will or won't be conducted as they go forward. With the construction schedule coming and commencing very soon, with summer coming, which is always traditionally a higher number of homeless folks accessing our shelters, as I recall, correct me if I'm wrong on that, and with the construction reducing the number of available beds, I would like to have at some point a report on how, the hope is that people will get transitioned through and into some other form of housing or diversion, and that is always the hope. What is the backup plan in the event that doesn't occur so that because we've been seeing the numbers at the CARES campus have remained up around that 600 number. So if we're going to take down 100 plus beds, I think the construction said, how are we going to open the overflow so as to keep the bed numbers high? You don't have to answer today. I'm just putting that on the radar because I don't know how the next agenda item is going to go.
I will put on the record that, one, the data is actually flipped. What we see is summer is warmer and people leave, but we are preparing for winter because we don't want to cut 100 beds in November and have a problem. No one who's at the shelter will be asked to leave because a bed has been eliminated. We will not be working through that. And you're right, we will have a plan in place. Our hope right off the bat is that as we're seeing summer, we're getting all of these case managers in, we're working with all of our partners through these MOUs, and we're really placing everybody. Our supportive housing, we're going to transition from the bridge housing term to the supportive housing. Eventually it will be permanent, but right now we want it to be temporary in nature so that it supports the needs of the campus until we're a little bit more stable and we're down below this 500 consistently. Then it will transition to more of a permanent function. But that will keep us over the 600 number with that building. And so we're going to be shuffling around until we get there. But yes, we will be very transparent.
Okay, thank you.
Councilman Reese.
Thank you, Madam Chair. Ms. Searcy, excellent presentation as always. I want to ask some questions fairly quickly. The first is about Mr. DeCarmine. I haven't had the privilege of meeting him, and so I don't know. But oftentimes I hear folks who take Mr. DeCarmine's recommendations and use that as somehow, beat us over the head with it. Like they say, he said X in the meeting, and therefore this is what's going on. I guess I don't get the sense that that's really what's happening, because I get the sense that as we brought a person in, we want to know all the warts and flaws that we are going through with the hope of improving, right? So it's less about he pointed out a failure as opposed to my belief that he's pointing out ways for us to improve. So can you speak to that a little bit?
100%. He's coming in as a partner. He was suggested to us through the ORG Code report by ORG Code. He is known as a leader in this field. And again, he is one of the only successful, flow of individuals that we see in the country with a safe camp on the same property as an emergency shelter, which is one reason why we really worked with him. Our place also worked with him when we were working through what does an appropriate case manager load and that kind of thing look like. Those were new things to our region. So to your point, 100%. He's very much about pointing how we can take what we have and build on it and improve. I would also say there's been multiple instances where it said, if we could wipe the slate clean and go back and do it again, we might have made some different choices. But given where we are in the political atmosphere and the resources that we have at hand and the need, let's figure out what the best way to move forward is, given our situation, which is very different than the rest of the country.
Well, and I'd like to know about a very specific thing, and this is something that our advocate community has asked about, which is a right to rest kind of statute. So I'd like to know his impression of those and whether he has experience with those. It may help us to inform future discussions. The second thing is, as to construction, I didn't fully understand the construction pains that Councilmember or Vice Mayor Jordan was talking about the reduction of beds, but I want to more speak to sort of the concept that as people are on site, are there hours of construction so that our folks are still able to get rest? Are we thinking through folks who maybe are sleeping during the day because they're working at night? I just want to make sure that our guests still are having the opportunity to find rest in a difficult moment in their lives. And so has some thought been had about that along those lines?
Absolutely. It's going to be a long couple of years for everybody at CARES, and that is a priority in the construction team's focus, is how do we make sure that people have safe entrances and exits, that deliveries and emergency vehicles have safe entry and exit, and that we stagger when things are happening, because it's going to be loud, it's going to be it's going to be an impact. So.
Well, and I'm thinking about dust and dust levels. So hopefully those are things that will be addressed with, increased cleaning protocols and helping folks who may have different breathing issues to be addressed. Let me ask about two items which also are related, but one is food. I imagine we are still providing meals on the campus, and the food quality is very high, I think, through Catholic Charities. How are we doing on that front?
We're doing well. The county, put out the food RFP really to offer support to our partners that were providing food. As many of us know, that wasn't quite the need that we had. We were already in the RFP process, so we had to see that through. We've closed that process without a viable option. A lot of the options were using kitchens in the region that were already at capacity for producing meals. So right now, the RFP for food has been closed, and we're working with Catholic Charities to enter into an MOU agreement with the county to keep, foods at, I would say, at the level that they are, but providing more transparency around what that is. And for the record, I think the county, we are wonderful partners with Catholic Charities, and we're very grateful to all that they have done, and we've not had any issues or concerns. It's putting it in a formal place,
Yeah, Catholic Charities is incredible, and the work that they've done is incredible. So I'm very excited to hear that, and I know that a lot of our board has spent time working on that, and so I thank them individually. Commissioners Hill and Vice Mayor Jordan have certainly been very intimately involved with that. So my own thanks to them for that. The last thing I'll ask and then pass the baton is about the bathroom situation. I didn't understand entirely what you said about the shower units coming to us. I just want to make sure that we are still providing a place for people to use the bathroom, to shower. I assume laundry facilities are still operational, all those good things.
Yes. So there are 2 bathroom units, 2 shower units, and a temporary laundry unit. Again, all of that will be demolished and removed from the premises when the new bathrooms and buildings are in. Very long story short, I think when we all saw the true impact of 604 individuals and our safe camp taking showers and doing laundry and using the restroom all day long, the wear and tear on those buildings happened a lot sooner than anybody thought. So about 6 weeks ago, maybe 8 weeks ago now, one of the shower buildings, the ceiling inside of it fell through. The other shower building was taken temporarily and put on a rotation. VOA did an amazing job, honestly, getting everybody a shower as they needed it. We had schedules. We have shifted to having showers turned off overnight to dry the facilities out unless there is a need that comes up. Of course, they're there and available. So in the meantime, obviously, we can't have women and men using only 13 showers. It's not enough to get us through this year of construction. So we are bringing in temporary structures for the women. So this is, right now we are renting a 3-shower unit. Again, 2 women and ADA for the women. That was just to get us through this initial period. We have chosen to purchase a unit because it is actually less expensive than renting it for a year. So that will be 5 total units for the women. And the men will have the 13 in the original building, and the women will be in these 5.
Commissioner Lucy, do you have anything?
I don't.
Okay. On this side, anything? All right. Thank you. Thank you so much, Dana. Okay, we have a very exciting item coming up here. Discussion of continued need for the existence of the Community Homeless Advisory Board or the current need for the Community Homeless Advisory Board to conduct monthly meetings with the possibility that the board will take action to reduce the number of meetings to at least 1 meeting per quarter or take action to recommend to the Washoe County Board of County Commissioners that the Community Homeless Advisory Board be dissolved. And this is for possible action. And I'm going to move it over to our vice chair, Mayor Lawson, because you did bring this up as an item, but I know that we have all been talking about it within our jurisdiction. So would you like to kick us off, sir?
Well, I think it's pretty evident from my comments in the past that I think that this is the place where we have made a lot of good things happen. Quite frankly, the CARES campus would have never happened without this board. The cooperation that we have between the jurisdictions and fighting the common fight together, I think is outstanding. I also think it's the gathering place. We were so siloed in the past where only round pegs would fit in this silo and only square pegs in this. Well, at least now we have the ability to talk to each other and to the ability, and Dana, correct me if I'm wrong, but I think we still have 700 plus beds that are open that have some type of barrier to access. Those kinds of things, we've still got a long ways to go on. Just having the communication amongst the different silos and the different organizations, I think this is the safe place to do that. We had obviously some very passionate advocates for a while that were probably not the nicest folks in the room at that particular moment. But I think that shows the passion that people have to solve this problem. Personally, I think meeting every quarter may not be enough. Maybe every other month makes more sense. I think to know especially what Dana's doing at the CARES campus, where we are on that. I know that we don't have a way truly to get out of the emergency shelter at this point. That is going to be the next step that I know that we are working on. But once again, I go back to the fact that this has been stood up for less than a year at this point. We've come a mile. We have come so far in that 1 year time that I think it's important that we continue to keep that. I think it's also important that the county staff hears, what from our jurisdictions, especially, the cities, that what you guys are doing great. And because there's so many good things happening. The small bad things really, in my mind, don't weigh out to anything. It's the progress that we've made in the cooperation. I think is super important. So for me, I'd like to maybe see that we stick around and talk about maybe every other month as a meeting. We do that for regional planning, and that works out quite well. We're able to address all the regional issues that need to be done on an every other month basis.
Okay, Councilman Dare.
Sure. So I'm going to be one that says I think we should stay every month, and let me give you the reasons why. I was one that helped form this in the very beginning, and the reason we put this together wasn't just for what we were doing. It's some of the things that need to be done. one, we still do not have a path if somebody is in this situation to get them. We can't lay out and say, here we go from here to here to here, and this is where we're at. We're getting closer, and I love what we're finding, but we get to be a leadership and an example to our whole community of what it means to work together and not silo. And I think it's crucial that we continue to have that conversation. I would say this, though. Sometimes it's hard because I know it could be hard on the county every month to have to lift and come and explain. But what if we just shift focuses and said, this month, we're going to focus on the region, like mental health, and let people come in and show the example of how we expect our region to actually work together and give that. And then the second one, we get more of an actual update of the work we're doing as cities, and we go back and forth. And that, anyway, so it doesn't necessarily have to be that huge lift every time for the county, because I get that that's very real. But I can say the one thing that does happen, this is almost too important. If you do it every other month, we all serve on boards. What that means, even for us, is we don't think about it for a while until the next board meeting comes. We try to, but we have so many boards we serve on, things we do. And so to me, the value of this is too much, but especially because we've not arrived. We've not arrived to where why this was started. We've done some incredible things, but we have a whole community that's still, we're still working and getting the veterans community where we want. We're still working in trying to get our youth services to work together, and all that kind of stuff has to continue. So I'm going to say that we must, I believe we should still continue to do what we do. We can shift some of the focus, but I think it's worth our time, and I think it's great for our community. Thanks.
Thank you. Councilwoman Jordan.
Thank you very much. I have mixed feelings on this. Part of me is like, we have come so far in 1 year and done so many great things, and we're right on the cusp of just really seeing this transformative campus really come to fruition. That being said, I know the lift that it is for the county every month. This is a heavy one, I tell you. I know, because City of Reno did it for quite some time. So, and you're entering into a construction period, which I know that's going to be a massive time consumption for all of the county's personnel as well. So I'm not in favor of a dissolution of this. I think this has become the clearinghouse for a lot of information for the community. We've watched our crowds and eyeballs on this committee grow over the years, and it really does become a way that information can get out and that we can receive information back from the community. But I'm also understanding of the weight of these monthly meetings on staff. So I'm interested in hearing from the rest of the board. I'm flexible. I don't know where I am on this. I don't want to dissolve the board. I do know that.
Okay, Commissioner Lucy.
Thank you, Madam Chair. And I find myself in a different spot than the membership, not in the sense that the success of this board is paramount, and what we have done here is paramount. Every individual that has sat here and carried the message back to our respective municipalities has done the yeoman's work of really trying to make this a front-facing issue. For so long, it was not. And to Mayor Lawson's point, had it not been for this board that was created out of resolutions in 2018 by each one of our jurisdictions, it wouldn't have been as impactful as it is today. And I want to point out the inspiration behind this board and the mission was to act as a transitional board, truly find a foundational way to find long-term solutions for individuals in our community that are experiencing homelessness, plain and simple. And I think we've put in the time, the hours. Many of us have sat as chair as this board. Many of us have put in extra time with but I also want to bring back that this is an advisory board. We really do provide a lot of information to the chairwoman and everybody's point. This is where it has been the clearinghouse for a lot of individuals to come. And as you look out amongst the crowd, I see individuals from the Eddy House, the CARES Campus, Ours Play, Hopes, VOA. You've got Karma Box. You've got individuals that work at the apartments at Sage Street. JD started as an advocate for housing and now is with Washoe County doing a number of issues with our housing issues. The DRP, the Downtown Reno Partnership, that was a formation. All of those, you see a lot of staff that have put on a lot of time and a lot of individuals, and you can see the community effort in here. What I would say, though, however, to your point, Vice Mayor, is that we are moving into that point of construction. And as an advisory board, we really need to give staff the time, instead of having an open meeting where we have clerks and attorneys and staff sitting in a auditorium listening to us, where we're really not making those decisions, or we really have to take those decisions back to it. They need to be spending time, instead of putting meetings together, focusing on the issue itself. As policy directors, we need to give our staff the ability to do the job that we've tasked them with from our end. And if there is need, to Councilman Dare's point, to have specific issues that are challenged that we see come up from time to time, we should bring this board back. Now, is dissolution the right answer? Probably not. But I would move that this goes to a quarterly meeting, a quarterly meeting that meets on truly the issues at point, instead of having staff come down and present to us once a month and try to put together presentations when they should be working on really how do we put the programming together? What do we need to address today? Because I know each one of us can sit in our offices and plug through a number of issues. These individuals need to be focused on just that. They need to be focused on what they can do to truly address the needs of this. And the regional, and then I also want to put into the minds of everybody, the regional continuum of care has been established. It's established and it's in place and it's working. So our staff have sat and are working on that regional continuum of care. And so to have policymakers sit up here when we're already having those meetings on that second tier, that lower level with our managers, with those, that's really where that work needs to be done. And to have them, I just think we're doing a disservice by not giving them more time in between these meetings. And come July, at the direction of all three entities and the acceptance of the county is going to take this over full boat. And we want the input of the cities. And we've pointed out here today, we work structurally and functionally together. We're happy to talk to each other. There isn't a time that we're not willing to have the conversation. And we know that this is a growing need. And each one of our entities has done something or another to truly address it. And we need to continue to do that. And there are places where we can come and present to the bodies as a whole, because we represent each of us are two members from our, but I believe that there's members on each of our boards that would like to know more about this and have a little bit more say. And because realistically, as we've pointed out, it comes down to funding and time to really address these things going forward. And in the bylaws that we set forth in section 5.3, it gives us the ability that we should meet every month. And we probably did need to meet, we needed to meet every month from 2018 on. But now that we've got that foundation in place, we really need to step back and give these individuals, because, and I want to point out, you're not seeing the advocacy of the anger and frustration here today. What you're seeing is staff members and people that are committed to seeing this work and move forward. So from my standpoint, watching staff and those types of things go, I'm not saying dissolution, but I'm saying let's give staff more time to really work on the issues, because it's tough for them to come back and give us a monthly update when a month is not a lot of time in today's world, especially in government, to truly make these things come to fruition. So we're going to continue to ask the same questions meeting after meeting, yet unless we give them 4 or 6 months to really deliver an answer for us, to show you substantial change, this takes time. And we've done a great job breaking down the barriers, breaking down the silos, making sure individuals can work together, making sure that we've identified those clear paths. I would advocate that, we meet again, potentially in June to see where we're at, have the discussion, give staff time, move these to quarterly meetings, but eventually, this was truly just a transitional board to identify who was going to take the lead and how that lead was going to run. And there is no doubt in my mind that every agency and every person in this room that has a intimate role in addressing homelessness wouldn't come to a City of Reno meeting, wouldn't come to a City of Sparks meeting and present as needed to show you what's happening and what's transitioning for your entire board, to educate everybody, because I think it's important that everybody is educated, your entire board. And so from an advisory board that takes staff time, money in consuming, are we really utilizing our resources appropriately when we should be allowing them to really work on the solution that needs to be addressed? Those are my comments. Thank you, Madam Chair.
Thank you, Councilman Reese.
Thank you, Madam Chair. For my part, I am somewhat agnostic about how often we meet, in as much as I'll be here whenever I'm asked, and so I don't have any issues there. But Commissioner Lucy, I don't think is incorrect. I understand the incredible staff resources and time that goes into it. I therefore suppose I'm somewhere between, I don't want to see it dissolved, but I am somewhere between every other month, or quite frankly, I could also do it at the desire or call of the chair, meaning if there was a need for it, we certainly would make ourselves available. We do sometimes hear similar concerns at each meeting, so I'm not, unfamiliar with that. I'll put out one other thing, which is either our body or some sub-body of this group should include people with lived experience, meaning this is something that has repeatedly been requested of our body, which is to expand it. I know that that would take some fundamental changes to the way in which it was formed, but I still think it's worth having a conversation about. So to be clear, I sort of fall into the camp of, I believe the chair could call meetings as required, perhaps not less than quarterly. But again, I have a sense that we all continue to row in the same boat. I think Ms. Searcy continues to impress every meeting. The presenters continue to show the way. And so I do want to make sure that I am mindful of Commissioner Lucy's comments about staff resources and time and the opportunity to do the work we're asking them to do. So those are my thoughts. And again, Commissioner Hill, I thank you for your leadership on this board, and for those who have served in that capacity before. We'll get there.
Thank you. And I also feel like just incredible awe about all the work that everyone has done before I even got into office. I mean, all this legwork was this board and other folks who have served on this board, and I thank you for all your work. So certainly if we reduce the number of meetings, I don't think that it says anything that this board, didn't put in incredible work and bring the community together. But to Commissioner Lucy's point, our staff are moving that continuum of care, and they are following that Built for Zero model and meeting with all of these organizations monthly, is my understanding, and doing the work on the ground. So I love meeting with everyone, because I think it's really important that we establish relationships and continue the dialogue, but I don't want to take away the time from Dana and her team to execute, because that's the concern, is it is going to get difficult as we move forward. So I do like the idea of coming back together in June, seeing where we're at, putting together a schedule then, but certainly quarterly. And then if we decide we need to call additional meetings as there are issues popping up, I can certainly work with the vice chairman and see if we have a need for those additional meetings. Commissioner Lucy?
Thank you, Madam Chair. And one other thing, I mean, if we were to adopt a quarterly meeting schedule, I believe in conversations with Ms. Searcy, she is very passionate about that. And as you pointed out, is very well connected with the community. I don't see her not working with staff and all those, Ms. Cochran and Mr. Klippenstein, to provide memos and updates to this entire board very quickly, so that we have that information readily available if questions arise from this board and from this, that we can reach out to her and then, reach out to you or the vice chair and ask potentially for a meeting or a discussion of something that is of grave interest that this board should discuss. Madam Chair, you serve as the vice chair of the commission. We have the mayor of Sparks. Very easily, we could conduct concurrent, thank you, my goodness.
Yeah.
A concurrent meeting of all of our boards if this is something that really needs to be addressed going forward. But our capacity is limited. From the commission standpoint, I can only do stuff within the unincorporated area and with our organizations that's happening. I can't dictate what's happening for development and multifamily and workforce housing in Sparks or Reno. I need to work with those councils to identify how we can move forward with some of that planning that we've discussed and different things of that nature. So really, that's where those decisions are made, and I think we've developed that foundation, and I think we continue to scream that from the mountaintops that is the mission. And I think as long as we don't lose sight of that, at least the six of us don't lose sight of that and continue to carry that message, I think that's important as well.
Thank you. Councilman Jordan.
Thank you very much. I'm open to the idea of a quarterly meeting, and kind of fleshing it out as it kind of moves forward and giving some, not just for staff's ability to really do some of the heavy lifting in between the meetings and not just the production of the materials and agendas for the meetings. But I think it's really important that we give clarity to the community as to what those meetings are going to be. In other words, no less than quarterly, so that they kind of know there will be another meeting in June, there will be, September, yes, I can do math, so that everybody kind of knows, because this really is kind of where the information comes through. What I would ask, though, if the vote is for a quarterly meeting, is that the information that comes to light that are common questions. Today we had questions about the showers. Let's say that had an update, that something goes out to the website and the community gets pinged somehow, or we push it out so that there's an update of a point of interest. The food service, updates on that. Who got the contract? Those are things that the community at large is interested in, not just this body. So I think if there's a level of understanding or commitment that those sorts of points of interest that are global in nature get updated and we can all share that with the community, I'm okay with a quarterly meeting. I think it should be crystal clear, though, that it is a quarterly meeting, and if we need one in between, you will call it.
And I just got a text from staff that we are required to meet quarterly. So we'd have to change our bylaws otherwise. So I think that, and then we can get that schedule published. But what's so great about Dana's team is they have been very transparent. When the showers had that maintenance issue, she had that up on the website and emailed all of us. But I like what Commissioner Lucy also said about, making sure that we're updated about these really hot topics and to check the website as things change. Yes, Councilman Reese.
Well, I would just add that if it moves to quarterly, which is, it sounds like perhaps the will of the body, that it may need to be longer than the 2 hours that we've currently given the meetings to. Well, the truth is sometimes I feel pressed to keep going, and we have lots of questions. So I'm not suggesting a whole day, but as the need arises, I'll leave that to the discretion of the chair.
I hear you, and I think that depending on the agenda items, we can kind of plan for that and make sure it's appropriately managed.
Madam Chair,
Yes.
can I ask Ms. Searcy a quick question? If
Absolutely, bring her up.
Ms. Searcy, while you are approaching the podium, we've heard from the board, there's concern obviously about outreach, about the concerns. Do we have a localized place on the county website or somewhere where individuals can reach out and see this? And can we push that to all of the community members that are participating in the regional continuum of care? Is that something that staff could do to kind of a monthly update about situations that have arose and what we're doing to address those situations? Yeah. Is that something that you were working on, ma'am?
Absolutely. So lots of different methods, but really that regional homeless services email, we get 20 emails a day, questions all over the place. if things, if we're hearing showers 2, 3, 4 times in a week, that's when you guys are getting an update. So we will push it out to the COC. There are many, many members. Most of them are in this room on that team, so we will definitely get that out. In addition to that, anywhere on our website, 311 is funneling everything to us. So if something gets, Reno Direct has also been sending things our way. So we're doing okay there. We'll get it out again and clarify. And if I may add, there are multiple areas for individuals with lived experience to provide feedback. There is a piece in Built for Zero. There is a committee as part of our regional continuum of care. And we also have our participant advisory boards, both at Safe Camp and at the emergency shelter. So if there is feedback out there and people willing to give, there are avenues to do that.
Thank you. Yes.
So, Madam Chair, with that being said, I mean, unless there are further questions by the board, I mean, I would make a motion that we move forward with rescheduling the CHAB to meet quarterly and to have the chair set those topics for those agendas in conjunction with staff to move forward with that and have staff provide at least maybe monthly updates to this board pertaining to subjects very pertinent and necessary.
Great. A motion's on the floor. Do I see a second?
Second.
Okay.
Discussion.
And discussion.
Thank you. I just wanted to clarify that the setting of the agenda, there would still be at these quarterly meetings participation by the board members for potential future agenda items. Okay.
So one discussion?
Absolutely. Yes, on discussion.
Thank you. So if this is the will of what the board wants to do, I won't argue more, but I will say that you're missing a component still. We're missing a component of why this came together. So if this is what we're going to do, I would challenge us to make sure we find another component. I appreciate what was just shared because that's a piece of it. But one of the things we get to do is we ask people from across all the different pieces who are working in our community, which is bigger than anything we do. I mean, there's tons of people. They get to come, they get to be a part, we get to hear. It's shifted in the last few months because we've been so focused on building this. But that's not how it started. We started bringing everyone together to make sure we could line out and work together. And with that said, I think some of that comes with accountability because they get to, it's not just us proclaiming what we're doing, but we're listening back to what they're doing. We're involved. We know we personally can go help or encourage in the right direction. That's going to be missing. And I don't see how it's going to be fixed without some accountability by us. So with that said, if that's, I get staff time again. I really do appreciate that. Actually, that's one of the reasons I can lean this way and I just won't just say no and be a naysayer, but I can say there's still a component of why we did this that I don't think we're hitting, and I think that we can find a creative way to maybe find some answers there. But I'd ask that we don't lose sight of a piece of this. That's how we started. We did a lot of that. Last couple of months, we've only done a little bit of it, but it is essential in my opinion.
Madam Chair, and just to further discussion for Councilman Dare. Councilman Dare, and you and I both sat on this when it was just 3 members, and we met in the Reno City Hall caucus room, and there wasn't any participation. There was no participation. There was no transparency. There was no discussion. There was just merely trying to find a path forward. And you're right. And until we made this more of a public setting, we were able to get that more of an engagement from the community. However, what I would tell you, to what Mrs. Searcy pointed out, there is that availability for her to really, yes, we do hear it, but I would argue that staff hears the complaints or the challenges 10 times over than what you and I hear. And they're on the front line, and we have many issues. And like I said, this is still an advisory board, so if there's something that really structurally needs to happen, this is not going to be a place where that action is going to happen. This is only going to be, if we take action, this is only going to be places where we take it and carry it back to our board as a mission, as a unified mission. And I think that's where we have that discretion once a quarter to say, this is a serious issue that needs to be addressed, and we do need to carry it back to our board. So that's why I would say the component that you feel is missing is not necessarily having individuals come to a public meeting, but having their ability to address it at any time they need, not a set meeting, yet be able to reach staff immediately to address a situation, because as you and I both know, whether it's a faith group, whether it's an outreach group, they need a solution today, not the following CHAB meeting where they want to reach staff and talk about the continuum of care. And then if it's something that needs to be addressed, whether that's at the county commission or the city council levels, that's really where those answers are going to be made. And then that's where the appropriations are going to be done. Those are when the decisions are truly going to be made, not at an advisory board. And I apologize, but that's, I mean, an advisory board is only beneficial to build a foundation, which we've done, and we've done a phenomenal job at that.
Yes, Councilwoman Jordan.
And I'll be brief. I know we need to wrap this up. What I will say about the quarterly meetings, I think, are great for all the reasons we've already described. What I have found is oftentimes when you're meeting with various groups, they generally have a point of interest. And I have had people comment that sometimes their point of interest is a fraction of what we are covering here, and they would prefer a much more robust, in-depth discussion about their point of interest. Example being the volunteers. They probably don't want to sit through or hear a lot of detail about some of the other things in which we discuss. We have found great success in holding, kind of issue-based Zoom meetings, which are facilitated by our own jurisdictions, but are open to whomever wants to participate in them. And then they're getting to drill down much further on that particular point of interest, whether it's healthcare at the campus or if it's, what is happening with permanent supportive, those sorts of things. So I think there is an avenue, and they could be driven by our own jurisdictions and probably have a more issue-based productive outcome than maybe a global discussion about 10 huge, broad issues here. So there's an outlet that I think we could still have great discussions in the interim, in between the quarterly meetings.
Yes.
Madam Chair, one last thing. And I promise I'll be quiet. I want to point out to the success of this board. Not only did the CARES campus come to fruition through a concurrent meeting during COVID, and an expenditure, significant expenditure and investment from all three municipalities. But I also want to point out Our Place. Our Place just won the Cashman Good Government Award last week and was awarded a statewide for its success. Nothing like that else exists in our state other than what we have done here. So to sit here and say that we have been tremendously successful, Amber Howell and her team at HSA, and that's why the county has stood up and said, gladly, we'd love to take part of this. We want to take part of this. And this is not being exclusionary of any of the municipalities, because every municipality chimed in and helped create what we have today for a homeless response. And to see that come to fruition in just a 5-year short time period is unbelievable. The feats that we have overcome in 5 years to address homelessness that have never been addressed in this community before is tremendous. And a lot of that success belongs right here. But it's really about the staff being able to do their job and do it effectively and not have this ever-looming board meeting kind of over their heads. So not to belabor this, but the awards are there, the time is there, the success is there, they're showing it. Let's give them the ability and the leverage to continue to do that. That's really, if I can strongly advocate for what they have done. I mean, the proof is in the pudding, and people are recognizing Northern Nevada as a true leader and a forefront for what we're doing, at least in our state, to address homelessness.
And I think too, and I know we have a motion and a second on the floor, but to Councilman Dare's point and to what Councilwoman Jordan brought up, I think there may be an opportunity for us to conduct these salons or perhaps these discussions on particular issue areas. And I think we can do it not at a public meeting, not when a clerk is needed or an attorney, and maybe there's, I don't know. I think the three of us should brainstorm. I think there's more collaboration to be had and more flexibility that those type of gatherings could provide. Okay, so all those in favor?
Aye.
Aye. Thank you very, very much. We will move on to board member announcements, reports, and updates to include requests for future board agenda items. Do I have, yes, Councilman Reese?
Thank you, Madam Chair. I would like to just request for perhaps it will be the June meeting now. I'd like to get an update about our regional protocols with regard to, I suppose it's smoke, heat, and related cold, right? I want to make sure that we are addressing the climate issues that affect our unsheltered population, and those, especially the smoke, seem to be happening every summer. I don't want us to get to summer and we're wondering, well, what about cooling stations and cooling centers and all those things? And so I just want to be proactive about it because inevitably we'll be asked about it. And so I want to make sure that we have a robust discussion here at this dais about those things as we move forward.
Thank you. Councilwoman Jordan.
Thank you very much. And I alluded to it earlier, just the understanding of the bed numbers and keeping those bed numbers at the 600-ish level through construction, how that's being accomplished. And then, the housing, kind of a snapshot of where jurisdictionally the affordable housing units live, so that we can just have a better idea of where they all are.
Absolutely.
Thank you.
And Madam Chair, it might be
Yes.
beneficial to Vice Mayor Jordan's, in addition, and maybe have Mr. Bonifant come and present about what that looks like across the region and where we're challenged. And he's done a very deep dive on that. And it was a wonderful presentation that he provided to us. So maybe that would be a great opportunity.
Yes, absolutely. Very enlightening. Great idea. Okay, any other items over here? Yes.
I'd just say at some point, I think it'd be wise for us to look at where do we want to be in the mental health. We talk all about it. We all know it's an issue, and we have goals, but we've never really said this is me. Where would we be if we say we reached our goal? Because if we don't even set that, we won't know. So kind of do an assessment. We did this in the health board and kind of pushed, and they gave a piece of the puzzle. But I just think for us, obviously, I mean, I'm hearing things that people may be being turned away because of extreme mental health, things like that. That's a problem.
Absolutely. Yes. And do you have anything, Mr. Vice Chair? Okay. And I'm talking to staff about all of our rental assistance programs, and that may rise to have a eventual presentation. I think that there's just a whole web of them, and I think it's very interesting for us to know how they all fit together. So we'll see if that should be a future presentation. We are going to go to our final public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the board agenda. The board will also hear public comment during individual action items with comment limited to 3 minutes per person. Comments are to be made to the board as a whole. Do we have anything, Madam Clerk?
There's nobody signed in.
Okay. I will call this meeting adjourned. Thank you.